we arrive at one of the very critical segments of today's program, the Healthcare Innovation Challenge 7 finale. This showcase highlights AI powered solutions that create a measurable impact for healthcare providers. To explain this challenge, what it is about, what is the impact that we have created through this, I now invite Mr. Shantanu Gaur to the stage. Over to you, Shantanu.
Thank you, Anisha. So, since morning, there have been a lot of discussions on how AI is playing a role in solving the challenges of the healthcare sector. The leaders have spoken a lot on that. But one of the things I think which got missed, or maybe they purposely did not talk about it, is the AI transformation journey in itself has a lot of challenges, right? So I was going through this report by one of the big fours, and it said that 80% of the healthcare AI projects never move past the pilot phase. Now, the number could be debatable, it could be north or south, but then the fact remains that a majority or a vast number of the AI implementations don't get to see the success that that the outcomes that the enterprises are looking for. And the challenges, the reasons behind that is numerous. I would not specifically go into those challenges, right? But you can just have a look. And I think all of you are already aware, maybe when the last time you tried an AI implementation that did not work, it could be one of these reasons or it could be outside those. But then that is something which, at Nasscom CoE, since our focus is on actually walking the talk and taking things onto the ground in terms of AI implementations. So we realized this pretty early on that these failure rates in the AI implementations is something that we need to address. And what we did was to come up with a program. This one is particularly this is the flagship program that we have, and this is the one that is specifically focused on healthcare providers, payers, and the medtech enterprises. And this allows any of the healthcare enterprises to de-risk their innovation journey. It is a structured program in which we follow a use case led model. We start out by interfacing closely with the enterprises to understand what their problem areas are. Once we have got that, we bring in the best AI solutions from across the nation, sometimes globally as well, to ensure that there is a fitment of the solution with the use case. And then we act as an extended innovation arm with the enterprises to make sure that the AI POCs are successfully able to take them from the POC stage to a full scale commercial deployment stage, and thereby avoid the 80% or 60% or whatever that number is, avoid that failure rate. And the good thing is that we have been working on this since quite some time now, a few years, and we have had the fortune of working with all the major hospital chains, public, private, that are out there in India today, and we have on-ground success stories with us. I will talk, about it as well. But just to give you, in terms of pure numbers, 30 plus healthcare enterprises we have worked with so far, and number is much more than that. But this is the number that I'm allowed to disclose. We have enabled the AI implementation for 50 plus use cases. What that means is that as I talk, there are 50 plus AI solutions that are operating in with a healthcare provider or a healthcare payer or a medtech enterprise that has been enabled through this program. And we must have easily evaluated about 800 to 1000 plus AI solutions across various, across the spectrum, various kinds of companies, in order to arrive at the success that we call it. These are some of the areas that we have worked upon. Again, this is an inexhaustive list. The use cases that we have on hand, it's very difficult for me to put it on a single slide. But these are, both from the clinical side, operational side. There was a, talk about how cancer is an important, focus areas for us, and rightly it should be. So cancer diagnosis is something that we have enabled with a few of the leading cancer research institutes, wherein we have enabled the diagnosis of cancer in a timely manner and a more accurate manner. That is to talk about the clinical use cases. We have also worked on the robotic surgery side of the things. From the operational side, we have transformed OPDs, reducing the patient wait times. We have enabled fraud detection on the insurance side of things. So there's a whole lot of use cases that we have worked upon. And as I said, I am again stressing the fact that all these are success stories where through this program we have been able to successfully enable the impact. Some of the impact is like for one of the implementations, we were able to successfully reduce the ambulance response time and cut it to half. In another one, we were able to reduce the turnaround time for cancer diagnosis to 1/10 at an even better accuracy. In yet another one, we reduced the patient waiting times in one of the most crowded OPDs by around 70% or so. And then we also helped on the claim side of it, where for the leading healthcare provider, the problem which they have is, which leads to revenue loss and also patient agony is to reduce the claims rejection by around 50%. And this is, all these are like a, very inexhaustive list of the kind of things that we are doing. This is again some of the healthcare providers that we have been working with, and then we have enabled success stories for them through this program. Now coming to HIC 7. So this marks the 7th edition of the HIC program that we have here today. And we have with us some of the leading top 7 healthcare institutes with us who have come on board for this program along with their use cases, which range from clinical operational side, leveraging different kinds of technologies, multimodal AI, generative AI, agentic AI, and whatnot. And I have a couple of stakeholders from the healthcare provider ecosystem who will share their success stories with us, who will share their experience in working with us, and the kind of use cases that they came on board with. So, first up, I would like to call upon Dr. Anup Warrier. Let's have a big round of applause for him. So, he is from Aster DM. And I would also like to call Mr. Please have a seat. And I would also like to call upon Mr. Sarabjot Bais from Narayana Health to come onto the stage. Let's have a big round of applause for him as well. So, Anup, starting with you first. When we were having a discussion on that this is a use case that you want to work upon, discharge summary is one of the big problem areas. And I have faced it myself. My dad was admitted in the one of the leading cardiac research institutes, and we had to wait for about 3.5 hours for the discharge summary to arrive. So he was physically discharged, but not officially discharged. And now I know what that means. So that's something that we are trying to change with this use case. Dr. Room, if you could, briefly talk about the use case and how your experience has been under this program.
So if you look at the overall discharge process in a hospital, starting from the doctor declaring somebody fit to discharge till the billing close and the patient out of the hospital, when we break it up and we see that about 30 to 35% of the time is provided for the discharge summary preparation and finalization. That is the time that the junior doctors take to compile everything, write down the discharge summary at one place, get the senior to review it and finally approve it. Then it costs. So it's not just about the 30 to 35% of the time period. It is also that for multiple further steps, it's also a rate limiting step, meaning certain things like the final pharmacy billing, etc., has to happen once the discharge summary is finalized. Okay. So therefore, it has an impact more than that 30-35% of that band on that time duration. So with this in mind, we looked at the value of faster discharge formation. It has value in two areas. It is a marker of operational efficiency, increased turnaround time. So therefore, it translates directly into the operational aspect of the hospital, and it impacts directly the patient experience. And both these things can be measured. So one of the things when we took up this case scenarios was, let us take something that can be measured before and after. So this is something which is easy for us to measure before and after. From the Nasscom, the kind of support which we had, that they were able to source a plethora of solution providers for us in terms of evaluation, looking at solutions, reviewing which fits in with our course, and with the sort of background assurance that it's not just a show tell and disappear, something that will be handheld through the implementation phase and beyond. Because as Shantanu was showing in the initial slide, in terms of conversion into impact, so taking this journey through, not just bringing us a couple of solution providers and then leaving it at, but taking us through the implementation to finally to the measurement of that impact, was something which was extremely helpful and which we found to be useful for us. That's it, Shantanu, from my side.
Thank you, Dr. Roop. There are a few mature solutions in this. Few is the keyword over here, but then one of the key requirements was the case summarization. And so, how your experience? I think I would just like to very briefly know how your experience has been being a part of this. And do we, can I expect more use cases, repeat use cases maybe next time around as well?
So,
On that.
briefly about the discharge summaries, though most of it we would consider is just a pull and plug from the EMR data which we have, constructing the course of illness or history of the patient during the hospital stay was one area where this AI has to play a strong role, because it has to collect all the information during those days in the stay and translate it into a narrative which is easily understood and encompasses all the adequate information. So that was the key thing which we are evaluating when we are looking at solution providers. How well can they give us the course of illness in that narrative form, which contains adequate information, which is understood by the patient and other care providers when we transform or provide this discharge summary to them. And we had evaluated multiple, and this is where the differences were noted in terms of the ability to provide this course of illness or discharge summary. The with just one capability of arranging the clinical events in a chronological order and reviewing the impact of these, or the actions taken on certain lab parameters or vitals, etc., again in chronological order, which for the discharge summary it does, multiple other use case scenarios come out of it,
Right.
like clinical audits, like mortality reviews,
Got
etc.
it.
All these come out of it.
Okay, thank you, Dr. Roop. Now I'd like to move across to the next use case, which is from Narayana Health, and this is around. I think this is a very common problem. We have a lot of, particularly the big institutions, have a lot of legacy medical records, and those are like a liability. I mean, in terms of, do you have to incur cost and resources to manage those? Accessing is a big problem. The idea was to leverage AI to convert that as that liability into an asset, and ensure that the access times is better, and you can derive some real value of from that data that can ultimately be used for the benefit of the patients. So over to you, Sarojot, just brief us very briefly on the use case, and also how your experience has been so far.
Okay, so I'll come down to the broader vision of it today. So at NH, like our EMR adoption rate for structured data, which I wouldn't call it completely structured, is around 65 to 70%. And for whatever reasons most of us are aware about in the healthcare space, the data sits in a completely unstructured format. And if you come down to our facilities, you will see MRD rooms filled with files, old files out over there. For compliance reasons, we have to keep them with us. So we were trying to figure out a way without putting a lot of bandwidth and resources. Our first option is to always build it internally, but we were thinking about a way where we could easily digitize those documents first of all, and once the digitization is done, structure them out without using the LLM calls, because they are pretty expensive in the first place. So if somebody could build, and we have to create JSON scripts every single time. Sorry for getting a little technical here, for every different format. So If you could create a model that could accurately digitize the documents, and further we could actually create a knowledge rag around it or create a SLM around it over a period of time, where we could add intelligence to the workflows. Today most of the EMR workflows are just digitization workflows. There's hardly any intelligence added to it. So we are also, we wanted to create a digital twin, and this is the first step towards it, where how would Dr. Devi Shetty diagnose a patient or for a specific surgery like CABG or something else. So junior doctors could learn quickly and use this intelligence that is already there with us. So and we didn't want to make money. The only ROI for us is that we could potentially minimize our MRD space, and most of the documents are digitized. But the bigger benefit would be we wanted to open source it out. That's a vision where other hospital chains could also put in their data, and we could have medical SLM from India with one of the widest data sets out over there, and labeled as well, because these are doctors who have written the prescriptions at the end of the day. So that's a vision around it, and Nasscom has been very supportive. Like, out of curiosity, I called Shantanu 2 years back when I joined NH. Being an entrepreneur before, I knew the struggles of entrepreneurs trying to access corporate partnerships, and he was very helpful. We did pitch in the first idea last year, and a lot of interesting ideas came out of it. And yeah, they are doing a great job bridging the communication gap between startups and corporates, and overall increasing the talent density in the healthcare space. And I genuinely feel that AI will impact healthcare the most out of any other industries out over there. We need talented entrepreneurs like yourself to come down and build something, and potentially one of the hospitals adopt it. As you know, Indian hospitals are very slow at adoptions because innovation is not the only problem, compliance is another problem, budgets are another problem. So
Great, Sarabjot. I think first of all, I would like. I mean, we are no, we will never be able to create an impact unless we have the support from the enterprise ecosystem, because we can create value only when there is an equally receptive enterprise who wants to innovate. We can only help in removing the bottlenecks of the AI transformation journey. Luckily, fortunate enough, we have been able to do that, uh, across the ecosystem. And thanks to leaders like you who have been a part of this journey. And one thing that I would like to say to all of you is, uh, innovation is something that is enhanced if you are trying to collaborate with a stakeholder who is trying to create joint value, mutual value. And at Nasscom CoE, we are like the entire LHIF ecosystem is built on that principle, that you bring everyone together with the objective of achieving an outcome for your enterprise and for the entire ecosystem as a whole. So I look forward to working with all of you. If any of you are struggling with any AI implementation or are exploring to do that, please reach out to us, and to any of our team members, or you can just drop us a note at hic@nascom.in, and we'll be happy to take this ahead. Thank you. I would also like to felicitate both of you. You are, our valued partners.
Let's give them a round of applause, everyone. Come on. Thank you, Shantanu and our leaders. It was great hearing the use cases that are deployed by Aster and Narayana.